Started. So Jill, we'll go ahead and get started. So for those that are new, we welcome to the Incarceration Prevention Reduction Task Force, the Behavioral Health Subcommittee. Yes, that is a mouthful, but welcome. And if you're newer, especially welcome. I'm gonna go ahead and read our land acknowledgement to you, which we start at every meeting. And then we do want to start off with at least a brief intro, just to kind of help us get to know one another. Just briefly, my name is Mike Parker. I work at Opportunity Council in Housing and Healthcare Integration, and I'm a licensed clinical social worker. So it's great to see all of you this morning. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. So with that, I have started on the intro, and if you would, maybe pass it to the next person. So I've already introduced myself, and I'll go ahead and pass it off to my co-chair, Dan Hamill, City Council member. Dan, go ahead and take it away.
Thanks, Mike. Dan Hamill, Bellingham City Council, Ward 3 representative. I've been on, this is my 7th year on council. And I can't remember how many years I've been doing the task force. It seems like I've always been on the task force, but welcome everyone. Good to see you all this morning.
Dan,
Sorry, my bad on that one. I'm going to pass it off to Brian. You're muted, Brian.
Sorry. Good morning. I'm Brian Thane. I'm Executive Director of the Bellingham and Whatcom County Housing Authorities, and I will pass it to Arlene.
Good morning. I think I've been on this task force for a couple of years now. I've lost track too, but it's been super exciting for me to work on making these changes and making these recommendations for change. It's really wonderful. My background is that I'm a marriage and family therapist for over 40 years, having been in private practice and worked for 10 years in crisis triage here in Bellingham. That made me into an activist, that experience. And I am now the co-chair of the Legal and Justice Committee of the task force.
Arlene, who would you like to pass it to?
Oh, Chris Cochran.
Hi, good morning. I'm Chris Cochran, mental health coordinator for Bellingham Schools. You know, I think my excitement about being part of this group is, as Dan and Mike both said, being a newer member, just learning from you all about what has already been going on, the good work that's been happening for a long time, and also learning the intersections between, on a broader scale, how our district can just be working in the best ways possible with government and agencies around us and people that are doing the same work. And I think also learning about those intersections between how these services and these programs are serving not only our students, but the families of our students. So thanks. I picked Stephen.
Thanks, Chris. My name is Stephen Gockley. I'm a co-chair of the Incarceration Prevention and Reduction Task Force. Also have the honor of sitting on Brian's board at the Housing Authority. I'm a retired legal aid attorney with Northwest Justice Project. And I'll go to Nathan.
Hi, good morning. So my name is Nathan Baima, and I work at the Public Defender's Office. I'm the behavioral health specialist there. And this is my first year as part of the task force. I pick, let's go to Bridget.
Hey, I'm Bridget Johnson. I'm Clinical Director at Lake Whatcom Residential and Treatment Center, LWC for short. And we specialize in working with individuals with chronic and persistent mental illness. And I'm very honored and happy to be a part of this task force. And this is my first year. I'll pass it off to Stephen.
I'll pass it on to Byron.
Thank you, Stephen. I'll pass it on to Mike. No, I'm just kidding. Hi, I'm Byron Mannering. I'm the Executive Director of Bridget Collins Family Support Center and been a participant on the task force for, I guess, kind of one of its original members. So really an honor to be a part of it. Who's next? Mike has his mic off. Have you gone, Mike?
Well, I was going to be there in case somebody didn't remember who we might have missed, but I believe Mr. Gardner hasn't gone yet. Mark, would you mind introducing yourself to the group?
Good morning. I'm Mark Gardner, Legislative Analyst for the Bellingham City Council, and I've helped provide staff support for behavioral health and the incarceration task force on and off, not consistently, nothing like Jill's Herculean efforts, but when needed, on and off to help with writing and research. So, and I'm here today to talk about the behavioral health section for the upcoming annual report.
And Jill, that leaves our illustrious Jill. Would you mind introducing yourself, Jill?
Sure, no problem. Hello, everyone. My name is Jill Nixon. I am Legislative Coordinator with the Whatcom County Council for the past 25 years and clerk for the task force.
All right. Make sure I'm off mute here. Thanks, everybody. And thanks for going through that. Obviously, eventually we'll get to know each other really well. Maybe we won't always do introductions, but without further ado, we'll go ahead and get started. Just to let people know, we'll pretty much go through the agenda as you see it in your packet. We can refer to it at any point. We might, as you heard, we are waiting on some folks from the Whatcom County Health Department. So there is an item on there for Ann Deacon. We may table that, or we're certainly going to take that to the end of the meeting. But the rest of it, I think we can go ahead and kind of proceed as planned. So starting up with that, actually, we item number 2 on your agenda is reviewing draft annual committee report. I believe that's in your packet. And Mark, we have you down as leading us through a little bit of that.
Sure. So it's there for your review, and we can have discussion and decide which improvements and additions need to be made. In terms of how I put this together, I plagiarized happily from various sources that I could find. I started with Jill's notes, and then I did listen to a number of the recordings of meetings just to refresh my memory and fill in gaps that I thought might be needed to fill out some of the sections. And I did consult with a few of the program experts, not by any means all of them, but and there was review by Ann Deacon provided a thorough review, and Jackie Mitchell has also provided some wordsmithing, although I haven't had a chance to bring those suggestions into the text yet. So that's basically how I put this together, and just waiting for your feedback.
Mark, thank you for that. One of the key things that I was hoping to get from you, if any of the committee members are going to give you some feedback, do you have a timeline that would be most helpful for you to get that feedback back by?
I don't have the overall timeline in front of me. Jill, do you know when would be, you can usually do a pretty quick turnaround, but when does this need to get to you in final form?
There isn't a set timeline per se. I would say we have the first draft already, which is huge progress. So maybe in the next couple of weeks, give Mark your comments. And Mark, if you could give me a more final version by end of May, that would be great.
Sure, I can do that.
I'll take just a moment. We ripped through that pretty fast, but I'll take just a moment just to give a little context for newer members. So if you haven't heard, as part of our output of the subcommittee, and all of the subcommittees and the main committee itself are due to, and Jill will correct me if I'm wrong, twice a year report back to county council essentially on the activities, the recommendations, and kind of what we're doing essentially in the committees. And so this will be our first one, and we'll really capture what essentially we talked about through what time period, Jill? We'll go through the end of last year, right?
The June report is the big report, so we generally report on what's been happening over the past year from the previous June. The end of year report is a much more pared down, sparse report.
But this would be a good primer for new folks to kind of catch up on some of the conversations. You might see some of the initiatives that either you're working on, you might see your agency named in there, but it would be a good primer. So we don't have huge expectations if you're new to give a bunch of feedback. We'd love it though, if you see things in there. So it is kind of a summary to some degree of what we're doing, but in it, you can also see some of what we're charting for the future. And we will get to that a little bit later in the meeting today, where we'll talk about 2021 priorities and a ranking exercise that we would like you all to do with some homework. Dan, did you have anything else on the committee report or anything that you wanted to bring up on that?
Yes, I want to provide some context for new members, for all members actually. If you look at I'm going to toggle between screens here. So if you look at it's packet page 1, pardon me, you've got a couple of programs in there. One's Grace, the other is Lead. Grace was founded a couple of years ago. That was based sort of on Everett's CHART program. CHART is Chronic High Utilizer Alternate Response Team. That program in Everett had a huge impacts on folks that were accessing the systems there, including courts, jail, housing, emergency medical services, police. It had like a 90% reduction in jail bookings and jail day stays. And if you look at our numbers here in Grace, you're seeing pretty similar numbers. I think there's I'm gonna toggle real quick here. 95% reduction in jail bookings and an 86% drop in EMS contacts. And then you've got some numbers there that show what that looks like in our community. And then the next program down is the LEAD program. That's the Law Enforcement Assisted Diversion Program. For folks, just for context, that is coming out of the prosecutor's office. That is Eric Ritchie's program, and Vanessa Martin was a huge influencer on that one. She's the admin lead there. That both of those programs, I'm pointing those out because I want folks to understand that this committee has been a driver for prevention, upstream prevention. And that's one of the reasons why I wanted to have schools on the team here, because we've had discussions all the way to birth to 3. That's how far upstream that we're looking. And Byron, he's on the team as well. A lot of us have talked about how do we make impacts that are going to be hard to measure, but they're going to be important. And they would reduce trauma in a person's life, especially in a child's life. And so the Grace and Lead are a little bit further along in our sequential intercept model, but they are they're kind of at the beginning of like number 1 on the SIM, and depending on if a person's re-entering, it might be more like on 4 or 5. So I encourage folks to look at the sequential intercept model, really get an understanding of that. And what I would like to do at some point is to build one that goes backwards in time. And so we have the 0 through 5. I'd like to do a -1, -2, -3, and really kind of work backwards on how we can impact people's lives, just working backwards. And then the other pieces, I think everything else is sort of self-explanatory. I do hope folks will take some time to go through and get some context on the other programs, especially the Recovery House and expansion of substance use disorder treatment. When we started this, there are a few of us that are original members on this call. We didn't have that much of an impact on substance use disorder, and now we do. We have a better impact. And I can tell you, I'm on a team with Ann Deacon and Barry Buchanan, Perry, and I'm forgetting one or two others. Second round of MacArthur Foundation grants. We work with communities across the country, and quite honestly, we're further ahead in many areas. And I'm not trying to pat ourselves on the back here. I'm just trying to provide some context that this community is invested in heavily in behavioral health, and this team that you're looking at here on the screen today is a big part of that. And so we have a lot of work still in front of us, and I encourage us to work together and think creatively to address both upstream and then midstream diversions. So Mark, thanks for putting all of this together. I think it looks good. I can't see that we're missing anything. Yeah, and the other piece that I wanted to point out was that Mike Parker has been a leader on introducing racial equity into the conversation here on the task force. It started here in this group with the GARE racial equity toolkit. Mike shopped around and looked for the best fit, and brought that forward. And that's now a part of what we have. The land acknowledgement statement that Mike read at the beginning, that's something that the task force voted on to do. Those are good things. And so let's keep moving forward. And then one other piece I want to mention before I'll stop talking here, the Racial Equity Commission work group that I'm on with Mayor Seth and Executive Satpal Sidhu, Barry Buchanan, Holly Huffman, Suling Zhao, Christina Michelle, Eric Ritchie, and others, Heather Flaherty. We're working to put together a stakeholders work group by June 1st. And that work group, composed of communities of color and other stakeholders in the community, will then help us define the Racial Equity Commission and have a seated commission by the end of the year. That commission will probably almost certainly work with this group and the task force on policy guiding decisions. So I want you all to have a heads up that we are introducing anti-racism in our work in a very deliberate methodology and with good intent, and we're trying on that, trying to make progress on that. So I just wanted to let folks know, and I'll stop talking. Thanks.
And thanks for that, and thanks for kind of the primer. I think that's helpful to walk through the report. For some of you, if you're like me, I didn't get finished with my cup of coffee in that entire report. So Mark, I do promise to read that entire thing, and I'll get back through it. I just want to just very briefly and humbly state that I took the mantle because I didn't see anybody else leading it, and I just want to admit that I'm a white person of some privilege. I may have a mixed race family, but myself, I do not experience that oppression or those microaggressions that the people do every day. And the reason why I felt like championing it, well, one, until somebody else takes it from me, and I'm happy to hand it to those that might have a better lens than I do myself. But until that time, somebody has to take this charge, and it's really crucial. So I just want to mention that in the purposes of our behavioral subcommittee, I'm kind of volunteering to do that, but it is not the job of one. So if we are having a discussion and there's disparate racial impact and we're not talking about that particular impact, or we haven't brought up that nuance, I really encourage all of you to bring up those pieces. But just so you all know, I have volunteered to kind of try to do that the best that I can and try to model implementing a toolkit, which for those of you that are new, essentially, we want to look at everything that we do, every recommendation we make, every solution that we pose to a thorny problem. We want to make sure that we've really looked at it from how it affects everybody, especially people that have traditionally been oppressed. Black and Indian persons of color and others have been differently oppressed by a criminal justice system than we all have. So thus, our solution set might look different depending on where folks have come from and what their past may have been. So again, I invite you all to do that. I humbly am taking on that role. And again, I'm happy to share it with all of you. If there's nothing else on that item, then our next up is figuring out our agenda. So item number 3, items for May joint meeting with legal and justice systems. Very briefly for new folks, we do a combined meeting, and Jill's going to double check me, but Jill's just twice annually, is it quarterly?
Twice
Believe
in November.
twice annually. Okay. We started this, Dan, what, a couple of years ago. We realized that there were just so many items that were really jointly important and salient to behavioral health and legal and justice. So this May meeting will be exciting. And if this is your first time, it's great to meet with those folk in legal and justice. Very different lenses and context that we bring when you have folks really in the middle of criminal justice. And you can see a lot of our folks on our call are really behavioral health steeped. So it's a great meeting of the minds. And to that, what items would folks want to see in that joint meeting? What agenda items would be particularly valuable? And with that, I'll stop for a sec and start some conversation.
Mike, this is Jill here. If I can interrupt just a second. For those of you who have your packet in front of you, I would refer you to packet page 6. I have this loaded up if you'd like me to share this item so you can all see on your screens.
Jill, would you do that? That'd be great. Thank you.
I can sure do that. Can you all see my screen here, the proposed agenda items for the meeting? After the full task force meeting yesterday, in addition to these 4 items, I just wanted to let you know a 5th item was added, and that is domestic violence offender treatment programs. So you'll want to include that on this list here. And the other thing I wanted to note was the 3rd item down, how to include development of the recovery house in the annual report. I see that Mark has included some information on the recovery house in this committee's report. That's great. Thank you, Mark. The Legal and Justice Committee members were unsure about how they wanted to make sure information about the recovery house was included in the report, and they weren't sure how to divide that work between their committee and your committee. So that's why this item is on there.
I'll jump in real quick. So update on behavioral health crisis response expansion program. Just for clarity for everyone, that's a reference to an unarmed 911 response for certain behavioral health calls, modeled after other programs, including Eugene, Springfield, Oregon, CAHOOTS program, and Portland and Denver's STAR program. This has been in development for about a year. There's a team of staff experts, so folks that work for EMS, data analysts, fire chiefs, police, who meet or who have been meeting pretty much every week for the past, I don't know, 5 months to try to figure out how this is going to work. And so that's what that's in reference to. And this is important because that body of work came out of this committee, and I brought it to the Bellingham City Council and was able to get unanimous support for directing the administration to come up with development funds to create a pilot project. So at some point, I think this group should probably figure out its response and in terms of chiming in on that program and what this group wants to see. As citizens, you should provide feedback and you're experts in many cases on this type of response. So I do hope that folks will be able to assemble a response to that, and that this group can provide whatever recommendations that are appropriate to at least the Bellingham City Council. But we are tasked with the County Council, so our recommendations go to that political body. But I do want to make sure that this group does talk to the City Council as well.
Dan, thanks for that. Stephen and Arlene, since you're also on the steering committee and you all tend to both be really present at many others, when you look at that proposed agenda, do you see anything glaring that would really be advantageous for our 2 combined committees to talk about in May? Maybe start with Arlene and then Stephen, if you had any observations.
Well, I think reentry is really a crucial piece. COVID as I understand it, has gotten in the way of many of the services that were being provided. And I don't know what's going on at this point. I really don't. I mean, usually Wendy would report about what's going on at the jail, and I haven't seen her for a while. So we have to, catch up on that. But also we have to see that it's solid and strong and working well, and helping us not have people return to jail.
Great, thanks, Arlene. Stephen, any observations from your shoes?
Well, I agree with Arlene about the importance of reentry, and I think it's especially appropriate at this joint meeting because I think we would benefit, first of all, from sort of jointly defining what we mean in the scope of reentry. In the course of the task force, issues have come up that could be called reentry that range from the fact that people were not given continuing medications when they were discharged from the jail. They were not re-enrolled in Medicaid coverage. At the same time, in legal and justice systems, we had a presentation from Goodwill Industries and their resume writing job search soft skills course. So there's a whole range of issues that would promote or otherwise impede people reintegrating into the community after incarceration. And some of those might be better housed in legal and justice systems and some in this subcommittee. And some of them might be overlapping things. So I think it would be valuable to sort of get some agreement on the scope of things. If we could talk about priorities of those or divide them up, I think that would be important.
So I think that these details are really important, but I just want to squeeze in this one promotion for prevention, because I would really like for us not even to have to deal with reentry and prevent people from getting into these problems in the first place. I dream big. What can I tell you? I just want this even not to be happening. And so I couldn't resist saying it. I'm sorry.
I don't disagree with Arlene's point. That seems like a separate focus in a certain way, but the other way is that the better job we do with reentry, the better job we do with the prevention of recidivism. Because if we leave people unhoused and unsupported, they really have nothing else but old habits. Right. And old needs to fall back on, and they cycle back into the criminal legal system. And
there's so many things that we really know work. We know that getting people jobs and reestablished in society pleases them and makes them feel great about themselves and makes them not want to have to do crime. So something so basic and simple, but yet it requires assistance and support. And however much we've had, I doubt if it's been anywhere near in the degree that we needed it.
And the other thing, Mike, I would say about reentry is the more I have tried to understand it, the more it seems to benefit from the same kind of service delivery model that Grace and Lead provide, which is a coordinated longitudinal kind of support by a team. It's not just you provide a service and wish the person good luck on re-entering community life. It's that there needs to be some oversight, some coordination, some acute level intervention from time to time. And so I don't know if that's something we'd want to talk about jointly as well.
Well, it refers to something that I keep trying to sell, which is I would like to see navigators in each piece of the service system, and definitely reentry navigators would be a really great job for someone, and that means you follow the person, the case, in whatever needs they have to make sure that things are coordinated and they happen, and then eventually you put yourself out of business, which is the goal.
So just
Arlene, that's
for the purposes of trying to create what this agenda item looks like, I'd also like to add on reentry and inventory, kind of pursuant to what the conversation or how it's going, but an inventory of what we have in this community that would include housing, so Oxford Housing, Pioneer Human Services, Sun Community Services. I don't know if Nathan knows any on the courts or the jail side of thing, hand off exiting jail. What happens? Is there a person that, to Arlene's point, is there a person that can help navigate complex, confusing systems of care? So what does that inventory look like? So we can at least have like a baseline of understanding, and then that'll help us make recommendations further.
So if you'd like to know what I do is I work with the jail quite frequently about kind of what Arlene was saying, that reentry piece, because there is a reentry specialist that is no longer there at the jail. I know they're in the works of trying to hire somebody. So oftentimes, yeah, like a person who's being released who has mental health issues might be released without medications. And so if that person gets on my radar, then I will contact the jail medical over there, and then they act as the reentry specialist at that point and get medications for that person. So they have at least a 7-day supply or 2-week supply, and then a 30-day supply for a prescription. So, but then once they're released from jail, they still might have the pending court case going on. Then I work with those individuals to try and get housing, try and set them up with treatment if they need that. Work with GRACE program, LEAD, all those agencies. So that's kind of what my angle is in terms of trying in the reentry piece.
So you're saying that you're partially doing what I'm suggesting.
Somewhat, yeah.
That you don't have enough arms, legs, and eyes that you could do all the tasks that I'm recommending.
No, I don't. There could be an army to work on all this.
What do you think about the idea of peers for that task?
For what?
Using peer.
Oh, just like a person that's helping that individual, like a navigator out in the.
Yeah, I mean, they can be professionals, but I'm wondering if since you're experienced at doing this work, it seems like a job that maybe people who've been through this system and struggled with it, and who have taken some training to be a peer counselor might be able to take this kind of job. But the idea that someone follows the person all the way through the system, gets to know them, understands what their issues are. This is very typical. It's similar to GRACE.
Yes.
And to the law enforcement people who are also behavioral health people as well, where they develop a relationship with the person, and that is a big support to that individual. Let it be one person over a period of time, because what we're looking for is to solidify our gains. It's not. I don't find it too valuable for us to do work and then have it drop through the cracks and the person cycle around again. I'm looking to see for solid support for people.
Thank you for the discussion on the agenda items, and I thank you, Jill, in advance to capturing a bunch of that. I won't leave it quite yet, Stephen, so I will be back. I wanted to bring up just something that came out of the task force of the whole yesterday. My apologies, the other people were on there. I was kind of on and off spotty, but there were a couple of things that really came out quite strong. One was great news that dollars are coming into Whatcom County, which might be employed for behavioral health affected folks in our criminal justice system. So just for task force members to have that in the back of your mind, because the first tranche, as it was described, may come in May. So it's quite possible that soon dollars will become, there'll be lots of competing interests on those funds. I would just like to argue that the participants or the folks that we're talking about on this call seem highly worthy and a really worthwhile investment. And as I hear about navigators, it made me think about, you know what, this could be a really, really important investment. The second piece that I wanted to bring up in relation to that also came out of yesterday's meeting for y'all's context is the challenges regarding staffing. And part of it was recruiting. It might be retention. It might be dollars. It might be people not going into the industry. And I see Britta nodding. So I'm thinking that maybe they're experiencing it. You know, Ann Deacon told us the other day that they have a behavioral health provider with over 100 openings. 100 openings. So it's sometimes money isn't enough. So this task force could be a spot for creativity. Do we need to sponsor a type of programming at the community college? Do we need to work on peer programs to incentivize peers and to kind of cultivate a workforce from folks that are directly affected? Anyways, whether they'll make it onto the to our joint agenda, I'm not sure, but it would make sense that we have that lens. One, that we may be asked or we should be offering recommendations that we feel will really help the population and reduce incarceration. And two, full acknowledgement that any recommendation we make, we better start thinking about how we're going to get people to do the work. And Stephen, I'll go to you and then we'll check if there's any other comments.
Thanks, Mike. As usual, Mike has added some brilliant observations there. I would say in terms of building the agenda that this would be a perfect time for the two committees to be talking about funding requests for exactly the reasons that Mike pointed out. And I think the force of having a joint recommendation to the task force from both committees for certain funding requests that we can identify now, and I would suspect there are some that we can identify now, would be very useful and very timely. I also think that maybe some discussion and some planning for how to process consideration of workforce issues would be appropriate. So I would add that to the agenda as well in support of Mike's point. Lastly, for the agenda, I'd just like to emphasize that the first item up there, the Behavioral Health Crisis Response Expansion Program, comes directly out of the BIPOC voices in the community over the last year following the murder of George Floyd. And so the timing seems fortuitous that the Racial Equity Commission stakeholder advisory group is being put together at about this time. If there's some way that we could encourage a joint meeting with that group or somehow infuse that body's perspectives into the city councils, the county councils, and our own task force efforts in that unarmed response kind of initiative in the community, I would like to see us working on doing that.
Thank you for that, Stephen. That is what you just iterated was is really espoused in the GARE toolkit. And everybody, if it's new, it's the Government Alliance on Race and Equity. And essentially, the thought is that we work in so many silos, and many of us are quite expert in our silos. We need representatives of all of those silos to be active and to be involved in any racial equity work, whether they be a formal member of the commission or maybe just liaising, is going to be extremely important across groups. Stephen, thank you for that piece. Anything more on our proposed agenda? It looks like it's going to be a packed and interesting meeting, but any more calls before I move on?
Can I just ask, I don't know if this goes into agenda items, but talking about what was brought up just now about a shortage of people in the discipline of both in social work, but in counseling, 2-year, 4-year master's level. I know I'm experiencing that in terms of maybe not directly with our district, but I know right now we have developed partnerships with our mental health providers in town where we had a school-based therapist program, and those are waitlisted, and those got waitlisted way after the normal clinics are waitlisted. And I know that the stem of all that is finding providers. I'm guessing Britta probably has quite a bit of experience knowing what that problem looks like too. I guess I'm just wondering if we make lots of good plans and we even find funding for amazing things, but we can't find mental health providers at master's level, and we haven't developed a fluid process with the human services program at Western to get students there into internships here, and we haven't looked at all those different those ways of connecting with people. It feels like a long-term problem that makes sense to start thinking about actively right now. So I just bring that up because I see that right now happening and people are talking about it. So I don't know how that connects to our discussion.
Chris, do you have any idea why this is so in general?
My first idea is that community health, like community mental health, is a challenging field and it doesn't pay as well as hanging your own shingle.
Yeah.
And right now with telehealth, it's pretty darn easy to hang a shingle. You pay $30 a month for Psych Today.
Okay.
And work out of an extra bedroom in your home and pay for insurance. And so I think if you can just charge, as somebody who's master's level, if you're a mental health therapist and you want to charge just private pay cash, charge people $100 an hour, and you don't have to pay 10% to a billing agency for insurance. You don't have to deal with all the 90 to 120 day delays with insurance. And then you can work as much or as little as you want. And instead of going to Compass or CMAR and getting paid $30 an hour, so that's my guess. If I had to put a stop on it, that's the end right there. But Britta might have some other ideas.
So I totally agree with what you're saying. I certainly saw that when I was working in crisis stabilization. The salaries were very, very low, and it's not enticing if you have your license to take a job like that. So there's one piece of the puzzle, let's put it that way.
If we could, I want to give a chance for Bridget to respond, then Stephen, I see your hand up, then we'll go to Stephen.
I think Chris and Arlene really outlined it quite well. I think the large systemic challenge that reinforces workforce shortages in Washington state in particular, right? We've got the separation between SUDP, so substance use disorder professionals, and licensed mental health, sorry. I'm in the habit of saying behavioral health. We promote it as being integrated, but we do have separate licensing flows and requirements to getting those licenses, including what is considered an approved supervisor to oversee clinical hours. That creates a bottleneck. And then our payment system with Medicaid and Medicare is brought up quite frequently because, for example, Medicare will recognize someone with a MSW in social work, but would not recognize the equivalent in counseling or psychology, right? And so there is a challenge that I know Unity Care, right, has faced, and LWC has faced as well, where not only is it a challenge to get and keep master's level, and then on top of it, licensed master's level clinicians, but then there is this added challenge of payment structures that will only reimburse for certain types of licenses. So it's really quite a complicated network of challenges, if you will. Some of them I think that we can start addressing, and some of them that will require us advocating, larger systems to take a look at.
Thank you for saying that. I certainly hadn't thought about that, and I do think that's a factor. And it actually talks to a larger issue, which is, personally, I think that all counselors should be cross-trained, and that the population that we're really talking about working with are most of the time with co-occurring disorders, and the staff really needs to be knowledgeable, solid in all those things. So it is, I agree with you, it's really complicated. Doesn't matter if it is complicated, we still have to deal with it.
Thanks for that, Arlene. Stephen, I see your hand up.
Thanks, Mike. Sorry to be so process oriented here, but I'd like to go back to the perspective of the agenda and say two things. One is that I think I was the one who raised the point about how to report on recovery house development in the annual report. And I did that because the initial capital development of recovery house actually came out of legal and justice systems to support drug court clean and sober housing. And then the programming, of course, has been overseen with Ann and the health department and this committee. I'm really satisfied with what Mark has drafted for the report on the behavioral health subject, and it would really be Arlene's and Raylene's call in legal and justice. But frankly, I would be fine with what we have there, leave it out of legal and justice and take it off this agenda as a discussion item. I don't really think, in my view, it needs further attention. Partly the other reason I say that is because, as you suggested, Mike, this has become quite a substantive agenda of topics. And I would just like to note that my sense of our meetings sometimes is we start at the top of the agenda and we get into, I won't say excruciating detail because it's not excruciating and none of it's unnecessary, but it is incredible depth. And we often end up, by the time we get halfway down, we're out of time and some things get bumped to the next meeting. I would like to encourage Dan and Mike from here and Arlene and Raylene from the Legal and Justice Systems Committee to think of this as the beginning of a series of discussions. I've come to the view that the two joint meetings aren't anywhere close to adequate for what the overlap and the intersections of the two committees have become. And so I'd encourage us to think of starting sort of work planning or sub discussions of these topics so that we get through all of them and we get a start on all of them. Maybe there are subgroups that continue the discussion or flesh out plans for them. But I just like the chairs to think about this joint meeting as kicking off these topic areas and problem solving within them, rather than trying to get too deep into any one particular one.
I think you're spot on, and we could never do any one of those topics justice, and even in a 1.5 to 2 hour meeting. But could we do a broad essay of what's in front of us, a SWOT analysis? I think we could. And I think that could be of great value, given especially the great minds that are here. And then maybe people can follow up on those breadcrumbs. Stephen, that's an excellent suggestion. With that, and with this packed agenda, if there's nothing else, we'll move on to the next piece. And Dan, real quick, I see that we don't have Byron. Would you mind leading us in the conversation about pregnant and parenting women and rising strong, and see if we get Byron back?
Sure, I'll give it a try. So Byron's really been the leader on this. He's enlisted Mike Parker, myself, and Byron's teams, both at the Skagit and Whatcom Bridget Collins locations. We have talked with Linda Grant from Evergreen Treatment down in Snohomish, and Dawn, and I forget her last name, I'm sorry, from Rising Strong over in Spokane. The idea is that we have a certain number of pregnant and parenting women who need substance use disorder treatment in an inpatient type of setting. And so we are exploring other models. Rising Strong in Spokane is very interesting. They purchased a convent and they use that facility to treat, I believe it's 30 women and their kids are with them. If they have kids, and often the partner is, or the husband is there as well. And so it's very comprehensive. They do medical assisted treatment, talk therapy, counseling, other forms of treatment that I'm not going to be able to be an expert on reporting on, but other forms, certainly very comprehensive. And same for Evergreen. They've done similar types of inpatient treatment as well. And so the questions that we've brought up are, do we have enough people in Whatcom and perhaps Whatcom Skagit where we could do a smallish facility, and what would that look like? And speaking of like Medicaid and Medicare reimbursements and things like that, how do we fund it? And so those questions are being vetted, and we have been on multiple meetings. There's another one this afternoon at 1 o'clock. I think folks from this committee have been invited to that. I'm not sure. So it's just in process right now. We have not said no, and we've asked ourselves that multiple times in the process. Do we need to continue this conversation? And the answer at this point is yes. We need to continue the conversation, and it's a service gap. It's a provision gap that we have in our community. So that's, I don't know, Mike, I probably missed a few things, but that's sort of the basics, and I'm happy to answer any questions if I can.
Dan, that was great. I'll just fill in a couple of other pieces. So some of the other things that we looked at is, and Dan, I think you mentioned this, I stepped away briefly, that, over 20 to 30 Whatcom families seek this service, normally women with children in tow, but sometimes mixed families or couples, and go without those services. And these are largely voluntary, although they could be coming out of a court system directly. But if so, the models that work the best have not had that been adjudicated, meaning it's been a voluntary placement for the family. It's been extremely important. Why talk about it here is because if we can interrupt the cycle, if we can provide these necessary services close to where these people live, people can stay in their schools, we believe that that'll fundamentally bend the arc and change what we need to do. People should not have to go to Spokane to get a bed where they can stay with their child in treatment, or go to Spokane, which is where Rising Strong was located. So we see it as something that's extremely crucial. It's a missing piece, and we appreciate any involvement from folks. We've had quite a few actually behavioral health subcommittee members show up and attend. Chief Tanksley has been there a couple of times, and other folks. So we really appreciate that input, helping us brainstorm it, and all those pieces. I would acknowledge one other thing, if you'll allow me, is that this is almost a model of what Stephen's talking about to some degree, in that we bring up something on this call, and then we have some groups take something and continue and bring it back. So this is kind of our reporting back to you all from some of these efforts. And Dan, I don't know if you had anything else on Rising Strong or on treatment, co-occurring treatment for pregnant and parenting women that still have their children with them. But if there weren't, I was going to just very quickly mention that another parallel process very similar to this with shelter plus care vouchers that the Housing Authority holds, Stephen has brought up, that also came out of this call. And there is a group who is pursuing and having conversations. Could we in some way target some scarce housing vouchers towards GRACE participants? And what would that look like? So there have been conversations with coordinated entry for homeless housing services, behavioral health providers, varieties. So that's kind of a model, I think, Stephen, and I wondered if that's kind of what you were getting at a little bit, that the groups in legal injustice or behavioral health might kind of brainstorm an idea, and then those ideas get further in the details or the weeds, if you will, get taken outside.
Yeah, that's exactly what I was referring to, Mike. I think we can pull in more people, we can get more work done between meetings, we can get more specialized work done, and we can keep the larger group updated as things go forward. I think that's worked in a number of contexts before, and it's working in the couple of contexts that you've highlighted just now as well. I think that's a productive use of our time and our expertise and our dovetailing networks.
Excellent. So with that really quick then on that, the latest update, by the way, is that Tony Casal and Brian, I still don't know how you still kept him, but that's amazing. Tony Casal and I met with some folks in coordinated entry, which is operated by Opportunity Council. We had a really good discussion about how that might function. It was a really important milestone for that group to continue talking. And just to let you know, we really are still working on this, and there's still some hope, and who knows, maybe the dollars being freed up might help, because I think that was one of our biggest issues, that, and of course, behavioral health service provision is a big one. So if there's nothing else on either of these two topics about kind of ancillary work groups happening, we would be on to the next piece. And Dan, I see that we have in our packet stuff about behavioral health, but I'm with you. I think us flying through that blindly without our experts doesn't make sense. Maybe we skip ahead to the 2021 priorities on the agenda.
Sure.
Okay. Do you want to kick us off very briefly with that draft document, Dan, and then I can fill in the blanks?
Yeah, I'm trying to find it here. Okay. Oh man, it's a it's a lot. So if you can refer to packet page 14, there's a ranked ordering system for several items. It's 15 items here, and so we're not going to be able to get to all of them, and we need to prioritize the ones that are on this list. So,
well, Dan, let me interject really quick. One of our thoughts was to show you this. We're going to ask you to do some homework. But what we want to do is to kind of have you see that draft list. And in this time, if there's an item on there that you thought was extremely important that this behavioral health subcommittee be looking at in 2021, if you see something missing, we'd like to know, because we can update that list. And then what Dan is alluding to in that packet, we'd like to send this to task force members. We have a lot of brainstorm. We have lots of good ideas. We also have a desire for focus. And we have found that when we lean in to a couple of chosen projects, we can get somewhere. And I think you've heard mention of the recovery house and some other things. So we want to do that same lean in. So this is an opportunity really for all the task force members, whether they're here or not today, to kind of rank what do they think is most important. And Jill asked me a really solid question. And she said, you need to define the importance. You need to give people some context. And just to remind us, we want to say, what is most important for reducing incarceration? What is most important for reducing the cycle of going back into criminal justice? Or what is most important for preventing that from happening in the first place? Is that school programs? What does that look like? So whatever your lens is and whatever you think is most important for that, that's what we want to see you ranking. So again, 1 being the most important, you think this is a really hot button item, and this would be based on your perspective, your professional perspective or personal, and please do complete that. You will get an email, because we didn't get it out to you in time, so apologies on that task force. You will get an email with this. And are there any questions, suggestions, or as you glance on it, what did we blatantly miss? And Dan, I'm sorry I cut you off. I just
No, that's fine. Yeah, this is homework. We're not going to do this right now, but if you do see things that we missed, then we need to know that, and we can follow up over email as well if you think of something later. But we do, we're mid-April right now. We need to really settle on these priorities. This has been a moving a landscape that is shifting constantly with COVID, and then the Blake decision right on top of that, and everything else that's been happening. So we need to make sure that we get these priorities straight. So this is something that you can take away today, and then bring back. Mike, what's the deadline here on this?
Well, I think it would make sense if we could get it before our legal and justice systems meeting in May. I think it could be helpful. What we'll do, task force, is we'll make sure that in an email with this ranked ordering exercise, we'll give you a deadline. I don't know about you all. I work a lot better if I know I have to get it back. If somebody tells me May, it's going to sit there until May. So we'll make it short. We'll probably ask you to complete it in a day or two. It shouldn't take you more than 5 minutes. But I just want to underscore, even though it's quick for you all, or we hope it will be, is that it's really important. As your co-chairs, we want to talk about what's salient. We want to talk about what's important to you all, and we want to be focused. And so we really appreciate your help in making us more focused, so that we can lean in real hard to something. Dan, did I miss anything on that?
No, that looks good.
Okay. And for those then, we're at other meetings, since we've gone through that one pretty quickly. Dan and I did, as your co-chairs, we wanted to follow up. We are crafting what we believe anyways is kind of our request of index. So on previous discussions, we've discussed what data elements, or what do we see from a behavioral health committee standpoint? What do we need to know about people as they're moving through the system, and what attributes? And so at our last meeting, we did discuss that obviously we want to know if people are behavioral health affected in whatever way we can, but really, and so crucially, and this is not a small ask, and we know that, the basic demographics of all individuals in all phases of this system are going to be really critical. We'll never be able to know if we're doing a good job for one group versus another, or if we have blind spots, unless we get that data. So Dan and I have been faithfully crafting just a request of index. We know it's challenging. There's tons of different systems, and Arlene, being on legal and justice, I'm sure you're more familiar with how many different programs, there's long arm, and there's this and there's that, and there's a lot of different pieces. So our request is going to be gentle but firm, that we be able to capture the demographic attributes of all individuals through criminal justice. And Dan and I will kind of wrap that up and try to encapsulate best from this committee. We'll be sending that off to Index between now and our next meeting. Anything else? Dan, did you want to do anything with behavioral health, or was there anything else from the committee?
I think that captured it.
Stephen?
When you say you're going to be sending that data request off to Index, is that something you're going to distribute within the committee itself as you do that? So we'll be able to track that?
Thank you, Stephen. Yes, of course. We're kind of working on the wording, because we want to make sure that we're succinct. What we can do is we can include that wording. You bet. Yeah, we'll share that with all of you so you can see what that request is. Jill's been really helpful. Jill, thank you again for kind of letting us know. Index does, by the way, have an email address, so other task force committee members should know. If you have a question for Index or a request, they do have a way to get a hold of. Jill, do you happen to know that off the top of your head so we can get that on record? If you don't, that's okay. We could follow up with folks.
I have an idea, but I'm not 100% sure. I will find out and email that information to everyone.
Okay.
I
So
believe
obviously the one that, go ahead.
Oh, I was going to say, I believe it's index/IPRTF, but I'm not 100% certain on that. So I'll check.
Okay. So Stephen, did that answer that question? Okay. Okay, so last up is that we're going to cover some the behavioral health funding. And Dan, even though we came up with this before we knew about the American Recovery Act, it's going to be even more crucial that members have some sense. So we are going to table this because we don't have a presenter. However, you will see in there in your packet information from the Whatcom County Health Department about behavioral health funding. You all should know, obviously, this is not behavioral health funding that is supposed to be summative of what's in our county in any way, shape, or form. However, it is a summary of that which is under the control of Whatcom County, which is no small amount. And when we talked about $44 million, if I'm not mistaken, coming to Whatcom County, obviously then that's part of that could be fair game for behavioral health interventions. So really crucial. So as much as you can, maybe make yourself advised of that, read through those things. The Behavioral Health Revenue Advisory Committee, there's another acronym for you, BHRAC, meets regularly, advises the health department on those funding decisions. We don't intend to replace that, but we do want to know what they're recommending. And we do want to be able to see if we see something missing or if we see something that needs to be doubled down on, which would be really crucial. Anything else, Dan, on behavioral health funding at this point? I think we'll have to table the item, unfortunately, to another meeting, but is there anything else you wanted to touch on that?
The only thing I would say, it's in your packet, page 7, just to understand the PETA continuum. So that's prevention, intervention, treatment, and aftercare. And that's how those funds are split up on the 0.1% sales tax for behavioral health that was passed. I think it was in 2007-ish. And then just the other funds that are associated with it. But I think it's just important to understand that, you know, there is a plan and it's based on PETA. So it's based on those 4 different steps. So just if you get a chance to please familiarize yourself with that.
And before we go to any other business, Dan, I wondered if you wouldn't mind just updating the committee members very briefly on 1590 and 1406.
Sure. So the Bellingham City Council passed House Bill 1590, and it's now an ordinance, it's now law. Whatcom County Council passed their part of it. So long story short, Bellingham has $3 million new dollars for housing and housing related services that are and mental health services, and Whatcom County has $2 million new dollars. So and the reason that I pushed to have Bellingham take its share versus it to be strictly countywide, which I was an advocate for initially, was that the Bellingham Home Fund is facing, or did face, a fiscal cliff in 2023. The rate of collection does not increase on the home fund. It's not attached to CPI or any other external financial indicator. So it means the collection rate remains the same. And building costs, as you know, as Brian knows for sure, have gone through the roof. We pay Davis-Bacon wages for the workers, so they get a very good salary when they're building these buildings. The building costs themselves are enormous, and then the land costs are continue to rise. So what was happening was that there was the split that was going to happen in 2023, and that's no longer the case. So the pipeline will remain full. We have several projects, I think 4 right now, that are in pre-application or application status. So you will see new housing, hundreds of new units being built over the next couple of years, and will continue to be built both at Samish Commons as different phases coming online. There's another senior housing facility. There's a food campus with housing associated with it. on Cornwall. There's another housing project in Old Town. It's just, we need to keep we're behind on affordable housing, so we need to keep the inventory up. We know that structurally, if we're going to end homelessness and help people stabilize, that we need housing, and we need safe, stable housing with services in some cases, and that's what 1590 provides. The other item, 1406, which City Council approved last year for it to go solely to the county. 1406 is about $700,000. That's new. It's not a new tax. It's a clawback from Olympia. Basically, we're getting our fair share of, well, we're getting a share of, I'll put it that way, of money back from Olympia. We need to get more, but that's part of it. So those two funding sources, 1406 is the small one, 1590 is the big one.
And just for everybody's knowledge, 1406, if one is interested in giving feedback into how those dollars are spent, the Whatcom County Housing Advisory Committee, which is established to really guide the county council in its creating contracts and the health department and its administration of those important funds, is the spot where that is going. And Brian, since we're on this conversation very briefly, and I've been off the Housing Advisory Commission since January, is there anything from the Housing Advisory Committee on 1406 or a direction that you know of to share with the group?
Testing my memory this morning, Mike.
I know, like year one, we said, hey, we got to do COVID. It was right in the beginning of COVID. There was not enough money to help all these people who had been situationally, lost their income. And so I know that the first use was really for something that nobody planned, which was eviction prevention, stop people from getting booted so that they're on the streets and getting into the criminal justice system. But
yes, it's primarily been used to date for rental assistance. The committee had voted to set aside a portion of the 1406 revenues over a 5-year span for capital construction of housing out in the county, outside of Bellingham. At the last meeting, they voted to flex on that a little bit and support some of the 1406 and 1590 funds helping to complete Samish Commons. But off the top of my head, I'm not remembering specific percentages.
that was pretty darn good for calling it, and thank you for allowing me to do that, and thanks for sharing with that group. So obviously, guys, these things are crucial. The 1590, by the way, has behavioral health funds. I believe it's 40% can be spent on behavioral health. And while 1406 isn't specifically targeted towards individuals with behavioral health, one of the most common things that we see with people in our system, whether it be the behavioral health system or the criminal justice system, is they don't have housing. They don't have an adequate, safe place to sleep. Nobody's going to get better. Nobody's going to stay out of jail if we can't house them. So thank you for the aside onto housing, and I'll take my housing hat off, get back to my chair hat. Is there anything else from members before we have Jill help us with public comment today? Seeing none, Jill, would you mind help us with public comment if there's any attendees?
Sure, we have one attendee to the meeting today. If you would like to speak to the committee, please virtually raise your hand now. And there is not a raised hand. Before adjourning, if Stephen, Dan, and Mike, you have a few minutes to stay behind after adjourning, I would appreciate it. Thanks.
You bet. Okay, so hearing no public comment, we'll go ahead and adjourn our meeting of the Behavioral Health Subcommittee. Thank you all for joining. Do look for your email. We'll be sending you out that draft matrix for you to do your 5-minute exercise to rank it. Thank you all for your participation and interest, and have a great week.